Hey guys, Dr. Ben here. Let's go over some questions. I'm going to spend the next half hour just answering anything you got. Go ahead and pop those down below. I've got a couple we're going to get started with, and then I'll be answering and responding to questions below. So what is functional medicine? Well, we're getting to the underlying why, and that's what I want your questions to be about. I want you to be thinking, even as you watch somebody else's question, or I repeat that question, think to yourself, why are we having these issues? What is causing it? Not just what supplement can I take to fix my reflux or whatever it is. We need to get to the why. We need to get to why is the body having these imbalances in the first place, and what can we do to fix them? That is the entire premise of what we do every single day with patients, and what you need to be thinking in your head. You know, as you look at any of our posts or watch my videos or anybody else out there, is okay, what needs to happen to change? Because just by covering a symptom up, even if it's natural, take some melatonin, oh, now I'm sleeping. Well, you didn't fix why somebody is not sleeping. So that's what we've got to do. We've got to get to these underlying whys. So welcome everybody. Pop down below where you're watching from, at least even if you're just watching and not asking questions. But love to see where you guys are all coming in from, all over the country, all over the world, all of Maine to California and North Dakota to Texas, everywhere in between. So love having you guys on, and let's dig into it. And I've got a couple questions to get started with. Hey Travis in Minnesota, a patient, not a patient, but a person yesterday asked a question about can hot flashes at night be caused by cortisol? And this is a great question because most people think about hot flashes as, oh, my estrogen's out of balance, I'm having all these issues, and where's that coming from? Well, it's I'm getting older, I went through menopause, whatever it is. But what we see is a lot of people, their hot flashes are actually basically adrenaline going through you. So here's what happens is that that blood sugar in the middle of the night starts dipping. And the body's response to that is to have the adrenals tell the liver to kick out sugar. And we store glucose in the liver. And so then we not only have sugar going into the bloodstream, but we have basically adrenaline going through our bloodstream. So this is a huge part of why people, I have some women, they'll lay a towel down on their bed before going to sleep because they know they're gonna wake up sweating, like drenched through their pajamas, etc. because they're getting into this fight or flight response. So if you are waking up, hard time getting back to sleep, your mind's racing, your heart's racing, your body's in fight or flight, it is probably because your blood sugar is dipping and you want to modify some snacks before bed to help with that. So hope that is helpful there. Let me go back and does quercetin interfere with blood thinners or any other medications? So a low dose of quercetin, here's the deal. If you're taking a blood thinner and you take anything different, even like they say with blood thinners, don't take green leafy vegetables, don't eat spinach or kale or whatever, which is total bonk. The whole story there is that if you're taking blood thinners, you want to go get tested, get your blood tested to see if you need to adjust your dosage, and then you take the same amount of vegetables, eat the same amount of vegetables, take the same amount of quercetin, anything like that. If you're taking fish oil or do anything else that might thin your blood, all you want to do is make sure that you're doing it the same, and then you need to modify your dosage accordingly. So if you are on blood thinners and you're changing anything, call your doc, call the place where you go and get your blood tested and say, hey, I'm modifying a couple things. Can we test maybe weekly for the next couple weeks? I just want to make sure we're on the right dosage. So hopefully that is helpful. We've got Julie there in Bentonville. Great to see you. Eric, always good to see you. And Rachel. And let me see what a next question is here. So go ahead and pop those questions down below. Yes, and there's Michelle. I keep a meat jerky bar by the bed in case I wake up, but I don't get hot flashes anymore. So Michelle has done a lot to stabilize that blood sugar. That used to be a pretty common thing to have those drops in the middle of the night, and that's a great way to do it. How do we know when we have a decreased fungal growth using oil of oregano? So it depends where that fungal growth is. If it's topical, like in the toenail fungus, things like that, you can see it. If it's in the digestive tract, track, usually we'll run through a bottle and at a pretty high dose, which ours ends up being about 10, 11, 12 days, we'll hit it really hard and drop it down some, add some probiotics in, and then do that maybe a couple times through there. So if it's digestion related, you can really just look for symptoms is going to be the big thing. So less gas, bloating, indigestion, just an ability to break things down better and move better through that digestive tract. Maybe even brain fog starts to go away, some of those things. But if it's topical, then you basically just look for those topical changes through there. And let's go here. How or what is the best way to check your blood sugar? So Lori, we've used blood sugar monitoring for years. I was in a seminar a bunch of years ago with Dr. Hold on here. I was in a seminar a bunch of years ago looking at, it was actually a cancer seminar, and we were looking at the metabolic reasons for cancer. And Dr. Mercola, Joseph Mercola, if you guys have seen his stuff, great website, unfortunately, they've forced him to take down all videos within 3 days, 72 hours, some pretty extreme hit pieces he's had, some crazy stuff. So anyways, Dr. Mercola pulled up his shirt and said, oh, look at this, I've got this blood sugar monitor, continuous glucose monitor on here, and we're able to see all day long what that blood sugar is doing. And that was pretty cool, but at the time, they were like $4,000 and it was just not realistic for patients to use that. So I said, well, what if we start checking our finger and just poke our finger 3, 4, 5, 6 times a day? And so we did that for about 5 years with patients. I'm always surprised that 99% of the patients did it. You know, they complained a little bit and were like, oh, I don't like poking my finger, but they did it and they learned, and we reversed diabetes and we changed people's lives left and right over and over. And now we've got what's called a continuous glucose monitor. We've been able to get that pricing down. So every new patient we start with at any of our offices, they're able to get that CGM and we get that blood sugar monitoring. It's an absolutely crucial piece to figure out what you need to be eating. So finger prick, we'll put a link down below. Michelle, can you let Brittany know which kind that we use? I think she didn't have the right link the other day, but if you can let her know what link we use on Amazon, and it's a great one, very reasonable, $40, $50, and it works really well. If you can get a CGM, you need a prescription only for it. Usually only the docs will prescribe that if you have diabetes, but the CGM is great. We use it with every one of our patients now. So yes, stabilizing blood sugar monitoring, that is amazing. Hey Kim, good to see you. Can a yeast infection be systemic, and how best to get that back to normal? So yes, yeast infection can be more systemic. This was really popular like 20 years ago. People were talking about candida infections and yeast and fungal overgrowth and all these things. Very common. If you open your mouth, look at the tongue, I've posted some of these pictures before, white coating, white overgrowth, very good indication that's coming up from the microbiome out of that digestive tract. If you've got toenail fungus, itchy ears, itchy belly button, even on nipples, we can get some yeast issues as well. So definitely some yeast infection, systemic things that can be going on, even brain fog and just a harder time thinking clearly, some of those things. So yeast infection can be systemic. Still, when we do that, I like to still take it orally. Take some oil of oregano is one of our favorite. There's other types of nutrients that can be helpful, but even eating more garlic and onions and some different things that naturally can kill off that yeast, we need to build back up as well. So when you kill down, you've got to build up the good stuff as well, meaning the probiotics and some of those things. But just by taking a probiotic is usually not enough to get that yeast infection into balance there. So is there a good home test to test our COVID antibodies, natural immunity? So Lindsay, I don't know of a COVID antibody test at home to do. The lab we use, Vibrant America, it's the one we've used since probably April or May of 2020, we were one of the first offices in the country to offer COVID antibody testing, and it's still one of the best antibody testing out there. They're still using it, but you have to do that in office. We can't drop ship that one. So you would Google Vibrant America. We can put a link down below and look for an office locally that that uses that, and you could go in there and do an antibody test. It's still the best, most accurate. It covers as many immunoglobulins as we would like to see, but again, that's huge. That natural immunity, really they should be using that when we're talking about you need a vaccine to work in the hospital. They should have tested every single one of those workers that did not want the vaccine, and they should have let them, if they have antibodies, let them use that immunity, get tested every 3 months, and that is just as effective, if not more effective, according to the research, that those people should have been able to stay in their jobs, keep helping people. They've been there for the last 18 months, helping people, being put in harm's way, everything, and yet they're getting fired because they don't have a vaccine, but they may have this natural immunity, which is actually more effective and lasts longer. So anyways, I could go on and on there, but yes, that's a great way to do it. Everybody out there, you should definitely be pushing. If you have antibodies, you should be pushing your company, anybody else, that is at least more effective than getting the shot. What do you know about quercetin? I've been told it's helpful with COVID. So quercetin can help pull zinc into the cells. And basically zinc is going to stop the replication of the virus, but the viruses, they have to replicate in a cell, so they break through that cell wall and then they're going to replicate. That's why viruses need a host to replicate, but quercetin is going to help that zinc get into the cells, because zinc by itself has a hard time getting into the cell. So yes, quercetin is great. It's also great for your brain, great for helping with memory and Alzheimer's, some of those things. Shelly, my daughter was exposed to COVID, so if she ends up with it, what do you recommend she starts taking and how much? So a lot of people, what they've been doing is doing some high dose vitamin D for adults. That could even be 50,000 IU per day for 3 days. Do some high dose there. Some C, zinc, the quercetin is great. Some people are doing NAC. So there's a lot of things that are helpful there. The nebulizer, we've talked about that before. Breathing in that food grade hydrogen peroxide can be helpful. There are some other things that I can't talk about on Facebook that have been shown to be very, very effective as well for certain people. And then even some of the nasal sprays are going to be good. You can do the xylitol nasal spray is helpful. We talked about that a couple days ago. Saunas are great, so getting into the sauna for daily for a couple days can rev up that immune system and really take care of some of that. So hope she's doing better. And yes, Michelle, the One Touch, send that over to Brittany, please, and we can put a link on that. Becky, I have an autoimmune disease. My body attacks itself randomly for no apparent reason. I have not gotten the shot. Okay, Becky, the rest of your message I couldn't see, so I'm assuming you're asking if that's safe or not. That is that's got to be between you, your healthcare team, and you've got to make those decisions. I have seen a few patients that their autoimmune conditions have flared up afterwards, as well as inflammatory markers like C-reactive protein went from 4 up to 38 right afterwards. Huge inflammatory process. So there are risk benefit ratios that you have to look at for everybody. And hey Michelle, great to see you. What's a good oil of oregano dose? So on we like a certain one. We'll post the link up there, Brittany, on FullScript, the ADP, and it's basically, this is going to be so it gets down into the digestive tract. There's a lot of different types. You can just do droppers, you can do gel caps, but those are going to open up and get into the bloodstream very early. We want to get down as far as possible into the digestive tract, so we have some time-released ADP that's going to get down, it's oil of oregano, get down into that digestive tract. And Michelle and Brittany, if you guys can put a link to FullScripts on there and that ADP, and we'll do a pretty high dose on that. We'll do three times a day and just really do some heavy duty kill off with that, and it makes some pretty big changes. And hey, Lorraine, you got a question? Go ahead and ask. Jessica in Tennessee. Lindsay, great to see you. How much oregano is suggested for fungal overgrowth in the gut? Yeah, so we'll put that link up three times a day on the one that we use with patients all the time. Any other questions? What are your thoughts on PUFAs? Jessica, PUFAs. Give me context on what you're talking about there. If it's the chemicals, PUFAs, or what you're talking about. And let's see here. Any other questions? I just started taking it with my zinc. Can children take it? The quercetin, yes. As of now, I have not seen any studies showing that quercetin is problematic for children. You just need to adjust your dosage. But of course, you want to do your research and look at some things that could be telling us whether there's issues or not there. But yeah, I haven't seen any problems there. Do you prescribe some of those things you can't talk about? I do not, and yet there's definitely sources out there that people can, and doing some good Google searches, getting into some Facebook groups, some different things. There's plenty of people that will help you with that, and there's over-the-counter sources as well. What are good blood sugars? So I'm assuming you're saying blood sugar levels. So good blood sugar level, we want it to be 85 to 110 all day long, morning, evening, awake, asleep, whatever it is, 85 to 110. Any of my patients out there that have been doing this, go ahead and give a thumbs up, because it's possible if you do what you need to do. I was even talking to a type 1 diabetic down in Texas yesterday, and he's in his 20s, and I'm like, Tell me a blood sugar number if you do what you need to do. He's like, and tell me that meal. He's like, well, if I have my big salad and chicken and avocado and whatever, it barely goes up 10 points. It might go from 100 to 110. And that's a type 1 diabetic that's not producing insulin at all, that has to take it externally. There's a couple thumbs up. Some of you guys out there have been checking your blood sugar, and you know that that's possible. Even for type 1 diabetics, if they do exactly what they need to do, they can keep that blood sugar 90% of the time between 80 and 120. We like 85 to 110 for non-type 1 diabetics. Jessica, thank you. And yeah, there's the full script on there. And when you jump onto that full script, you might have to have, because these are doctor-only supplements that we use, you might need a recommendation for that. So just send us a message and say, hey, I want to order up that oil of oregano, and we'll give you access to that one. Jane, great to see you in Massachusetts. Go ahead. Any other questions, pop those down below. Got lots of information to get through. I've checked everything in blood work. Why would B12 be 1800? Everything else is negative. And Lorraine, you're not taking B12. Usually, B12's under 600, 800, something like that, unless somebody's taking it. So, not sure what's going on there. Are you taking B12? But again, everything else negative. If you're looking at the lab range, way out here, we're looking at the functional medicine range. And so this is why it's so important for what I've seen over the last 20 years. I've come up with a range that I really find healthy patients need to be in. So a lot of times people look at their blood work and like, it's actually pretty good. Eat better, lose weight, you'll be fine. But really, we find a lot of different things out of balance because we're looking at that more narrowed, healthy range. Jessica, polyunsaturated fatty acids. And so Jessica, in regards to what about those? Should we eat them? Should we not eat them? I don't think. Anyways. Go ahead and let me know what question you have there. Sunny, why is it that I feel good and then as soon as I eat or drink something like tea or coffee, I get bloated or feel bloated? So this kind of like what we were talking about with that gut and the microbiome is out of balance. Basically, your body is so reactive right now that it doesn't take much of anything, eating, drinking, whatever, and it starts to expand. We get gas, bloating. The microbiome is out of balance. It's basically fermenting in your digestive tract, and it's going to, some people, they look like they're 6 months pregnant. Things are sticking way out this far, and it's because that microbiome is so far out of balance. So you've got to take a step back, kill off, bring in probiotics, probably kill off 2 or 3 times, work on that gut lining if the liver's off or if you need enzymes, whatever else, you've got to go through and just really fix up that digestive tract. Kate, what do you think about quinine there? I don't know. Is it going to be the be-all and end-all? Is it going to be any more effective than anything else? That I haven't seen any specific patients or real research showing that that's like, wow, that's a huge win to use that. I've seen, I know quite a few people that have used HCQ and gotten results from that, and they are similar. Do you have a good natural remedy for cold sores? So, Chris, cold sores, remember, just like any chronic viral infection, that's what that herpes is. It's coming back, and it's usually when people get run down, when they get stressed, when their immune system's off, these different things. So really it's about building the body up and getting the body as strong as feasibly possible. Yes, you can use lysine and some different nutrients, NAC, some of those, but ultimately you've got to get the body as strong as possible. Do a complete blood panel looking at hormones and inflammatory markers, autoimmune markers, all these different things, and figure out why the body is depleted, and then help build it up, because really that's a body depletion. So iron and ferritin, Jerry, looking at, really iron, don't worry about that much. Ferritin is the big one to look at. Women, 40 to 125, and men 40 to 150. Remember, I always say ferritin, if there's only one blood work marker that I could run on everybody, it would be ferritin. Ferritin is going to tell us so much. I see way more high ferritin than I do low ferritin. Yesterday, just had a lady, and she's like, oh my gosh, I've always been anemic, and now it's 275. So low ferritin is going to tell us leaky gut, malabsorption, we've got some digestive issues, we're losing blood, bleeding too much on menses, things like that. Excess ferritin, which I see way more common than low ferritin, ferritin is stored iron, it's going to tell us someone has high triglycerides, potentially fatty liver, C-reactive protein inflammatory markers are high, that they've got insulin resistance. 99% of the time it holds true. It's the first marker that shows up on our blood work panel, and if I see that, I know that person is in this inflammatory metabolic condition. All right, there's the link to full script if you do need that Oregano or any other NAC, anything else like that, it's on there. What other questions? Will you be opening a clinic in California? Yes, so California definitely is on our radar. We're looking at getting out as quickly as we can, but again, we want to make sure that we're opening with excellence and helping people get the care that they need. And so for now, people can work remotely with either of our offices at this point. So the lysine, yes, that can be helpful. Let's see what other questions. When should and how often should you check your blood sugar? So Lori, I'll put this, and Brittany can put that link in there as well. Blood Sugar Doesn't Lie. This is my latest book, and it goes into lots of detail there on when and how and why to check your blood sugar. But it really depends on the person. Since we've been using the CGMs, we see some people, they'll spike in 15, 20, 30 minutes. We've always tested at 45 and 60. Now we're seeing even people spiking under 30 minutes. So it has to be a variety of time. You've got to check before meals, after meals, all types of different things to get a good feel for where that blood sugar is out of balance. And Patrick and Lisa, you are so welcome there. What can someone do to deal with COVID long haul symptoms, fatigue mostly? So here's the deal. COVID is not a long haul virus. Okay, and that's what I want you guys to get out of your head right now. COVID is not a long haul virus, meaning that it's a seasonal upper respiratory infection, just like the flu, just like other coronaviruses, colds, things like that. COVID is not a long haul virus, but just like anything, it can stir stuff up in the body. So what we're seeing is that majority of people that have COVID long haul actually have reactivated Epstein-Barr virus. So EBV is going to be the monovirus, and it's going to cause that fatigue and brain fog. And just like if somebody gets mono, they're going to be, man, I got to take a semester off of school, whatever it is. So one, you could test for chronic EBV, so recurrent Epstein-Barr virus. But even then, kind of like we were talking about the cold sores, you've got to work on calming down that inflammatory condition in the body. You got to build up the immune system, get the stress down so that you can handle anything that comes your way. So ultimately, you've got to build up all the systems you possibly can. You've got to make sure that the body is working as well as possible and beat down that Epstein-Barr or whatever other virus may be causing these long haul symptoms. And Jenny, where are you guys at? I can give you some ideas there. And Lorraine not taking any. I'm mostly vegan. Yeah, I haven't seen. We don't test B12 on everybody, Lorraine. So I only see it occasionally if somebody brings theirs in. It's just not really important for us. It doesn't change a lot of what we're going to do. So I mean, your body just may produce enough B12. So yeah. So I don't see B12 as an indicator of potential cancer or anything like that. Alan. Yeah, okay, if you got any questions on that, just let us know, but you can get a lot of different things. And great to see you. Allergies are worse this year. Any recommendations other than immunity boosting? So, here in northern Colorado, we had all the smoke. We had a lot of issues again this summer that made it not so much fun to be outside. So that may be part of it. But that's where even quercetin can be helpful. Bromelain, turmeric, some of those can be helpful to calm down that allergy response in the body. So there are some nutrients that are helpful with that. And then double check what you're eating. Make sure you're not getting too much gluten, dairy, anything that's mucus producing can cause those allergies to be worse as well. Yeah, Jessica, you could check with the MTHFR with the high B12. Yeah, she probably is. The majority of people that check their MTHFR genetics are going to have the genes for it, but I haven't usually seen that cause the high B12. Right, what other questions? Have you come across any peer-reviewed studies on vaccination in pregnancy? I know this is controversial. Yeah, so, Kayla, great to see you. Hope you guys are doing well. Haven't heard from you in a while. Shoot me a message. Let me know what you guys are up to, and we can have a more in-depth conversation on this. But the CDC just came out today, going, "Oh my gosh, all pregnant women need to get vaccinated." And it's like, you know what? For one, I'm concerned because there has been no long-term studies done with this and with this type of vaccine, and that's the thing that I'm looking at. Is it's not just, ooh, is this one safe or not, but just the whole technology. This is new. It's never been used on humans, and hopefully it turns out totally fine. Everything's great, but we're usually pretty darn conservative when we're talking about pregnancies, when we're talking about pregnant women, babies, all those things, and like even supplements. Don't take these supplements, don't do any of these things, and yet now we're just like, totally pushing, even when there's really no research showing that COVID's worse with pregnancies, or those women are having way worse problems, anything like that. So if it was me and Michelle and I were pregnant again, we would be very hesitant about that, just because, you know, I don't know, and nobody knows, you know, long term, we're talking even 3 to 5 years, you know, it's never been done on pregnant women before, and so, you know, if we have this mass thing and then something happens, like thalidomide or anything like that, I mean, you can't take that back. So Kayla, we can have more conversations about this, but yeah, I just have not seen any reviews that way. Yeah, our functional medicine doc told us that appears to be safe and effective. So, you know, I would question where they're getting their information and who's supporting that. You know, it appears to be. Unfortunately, I've seen quite a few patients in office that have said otherwise. So, you know, Jane, I get you. And let's see what else we have here. Any other questions? Pop those down below. Do you have a great prebiotic recommending and is safe? Or sale, and do we sell it? So the prebiotic, I like the butyric acid. It's basically helps feed and build up probiotics, and we'll use that for people that have extreme gut issues. They've got bowel movements 10, 20, 30 times a day, things like that. So yes, that butyric acid can be really helpful. Shoot us a message, and we can get you that one as well. Kathy, awesome. Look forward to seeing you as well. It's going to be good. We'll go over everything and come up with a game plan. Hey, Don, down in Nashville, how you doing, buddy? Good to see you. And what other questions? Okay, Jessica, there we go. Are the polyunsaturated fatty acids, are they dangerous? And do they cause issues? I wouldn't say that they're necessarily dangerous. I don't know if they're going to be beneficial, really. I haven't seen any great studies, any used it with patients, anything like that. So I don't think it's a huge benefit to using those, unless it's something very targeted that you're doing for that. But I don't think it'll cause. I wouldn't take tons of it, but I wouldn't use that specific. There's better things. Candy, great to see you. One of our hardcores out there. She's been working really good. Ferritin is at 12. What do you suggest? Mandy, yes, ferritin under 40 and you're low. Even 12 is low in the lab range. So ferritin low, remember, either you're losing lots of blood like menstrual cycle, you're losing blood through the digestive tract. I'll show you this picture here of a patient. I've shown this one before. This was her upper GI scope in the small intestine. You can see all the damage, irritation, raw tissue. That was in January. By August, they did another scope, could not find any damage in that gut lining, and she made this slide up for us because she was doing so much better. First patient that ever had a upper and done pre and post care, and so a lot of people are losing blood in that digestive tract, and so they're actually bleeding in the gut. It gets reabsorbed, so you don't see it. You won't see blood down in the stool, but it's also probably leaky gut. You're not absorbing like you need to. We've got some major gut work to do if you're way down at that ferritin. There's no way you're feeling good either, because you're not getting oxygen to your tissues, especially your brain. You need glucose and you need oxygen to function optimally. Are you going to be opening a clinic in Kansas? Sherry, we are looking at Kansas City and Wichita in the spring. That will be one of our first offices going up in the spring in the either Kansas City or Wichita areas. What could be the root cause of painful ovulation? So, you know, when we have hormonal imbalances like that, a couple things to think about. One, it can be structural. So it could be an endometriosis, it could be a cyst. If you haven't had an ultrasound and it's pretty intense, like you can't function that day, I would go get an ultrasound. I'd get some type of a view to see what's going on there, see if you do have cysts on the ovaries, anything like that. And if not, then we've got to look at your estrogens, progesterones, liver enzymes? Are you detoxifying like you need to? A bunch of different things to see if there are some hormonal imbalances as well. But get checked out, make sure there's not a structural issue. Jessica gave birth, and this is very common. We see after giving birth, women are not able to get their weight off. So one of the things that you need to look at is you need to get your TPO and your thyroglobulin, your TG antibodies tested. These are checking for Hashimoto's. A lot of times it's like 80% of the women that have low thyroid actually have Hashimoto's, and one of the major causes of Hashimoto's is going to be going into an estrogenic event or coming out of an estrogenic event. So having a baby is one of those. Many times I see women say, oh, I was never the same after that first, second, third, fourth kid, and it just really kind of trashed them, but it was really because of that autoimmune component. And Elena, great to see you. Jessica, you are very welcome. And what hormone markers should someone run? Okay, so Amy, great question. So here's hormone markers that we run. Free and total testosterone, DHEA, cortisol, the 3 estrogens, progesterone, and DHT. So those are the main hormones that you should be testing. And yeah, there's always some more you can do. And there's people will argue, should you do saliva? Should you do blood or whatever type that you want to look at? We just do it in the blood work. It's simple. We don't have to do saliva test and send it out to the lab and do all these things. We just do blood work. It gives us a lot of information, and then we can go from there. So cortisol, DHEA, free and total testosterone, the 3 estrogens, progesterone, and DHT. So hope that helps. And Linda, help for ALS. We can talk more about that one on the side, Linda, but that is a tough one. What is the best way to cleanse your colon at home? Well, here's what you have to do at first is you've got to make sure you're eliminating every single day. ABP, always be pooping. You got to be going every single day. And if you're not, do whatever you got to do to get your magnesium up, vitamin C, any of your fiber, roughage. There you go, you like the ABP. So you got to get that going every single day. You can do things like psyllium husk and chia seeds and some of those things, but really it comes down to eating as clean of a diet as you possibly can. Good proteins, lots of vegetables, at least 50% of your plate, a whole bunch of vegetables, good fats, things like that. But you've got to be going every single day. And what can we do to raise white blood cells? So if your white blood cell count is low, remember, it's usually in a chronic condition. So look for your liver enzymes to be high and look for your lymphocytes to be high as well. Very good indication that you have a chronic viral infection. Could be Epstein-Barr, could be West Nile, a lot of different things, but you've got to figure out what is still pushing down on that. You've got to build up that immune system. You've got to work on decreasing stress, your cortisol better, blood sugar imbalances, decrease that immune system, lots of different things. But first, you got to figure out why it's low, and that's usually a chronic immune issue. Jenny, great to see you. Hour south of Chicago. We've got some patients on here, Linda, some other people that are from Illinois that we work with remotely, but unfortunately Illinois, it's tough in there, not a lot. There we go. Amy, consideration opening in Indiana. Yeah, we're looking all over the country. We've got a lot of people that need help, and we're gonna expand as quickly as possible, but still with that focus on excellence and helping people as much as we possibly can. Yes, do we see patients remotely? This week I've talked to a lady in Pennsylvania, in Texas, multiple from Wyoming, multiple from Nebraska. There's one other state. So yes, we see patients remotely. So just DM us and we can talk about that. And I've got a couple more here. Kayla, who's pushing it? Is it work, or I mean, I guess you work for yourself. But anyways, we'll talk about that. Shoot me a message before you do anything. I want to talk to you. Definitely, I've definitely got concerns. Okay, our alternative milks. Okay, I would make sure you're sticking with unsweetened. And that would be great. Why do people still think that are infecting? Is there evidence of that? So, I mean, this is a virus. They found that deer, like 40% of the deer in Pennsylvania were testing positive. So could the deer infect people? They tested enough watermelons and all these things and found viruses on there. So, it's really kind of silly to just think that this is going from person to person, nasal passage to nasal passage or mouth or whatever it is. Viruses can travel. There's a lot of different things that can happen. So it's not just from one. This is really to divide the country. One part of the people versus the other part of the people, and it's a us versus them type of a thing going on. It can go from anybody to anybody, and so sure, just like a cold or flu or anything, we need to wash hands, and we need to be, if you're sick, stay home, things like that. Hey, Paula, great to see you guys. Hope you are rocking it wherever you are in this world. Natural support diet supplements for anxiety. So magnesium can be helpful, and inositol can be helpful, but the number one thing that we do for anxiety is to do a brain map, quantitative EEG. We look at the electrical activity of what's going on in the brain, and then we do neurofeedback to help calm that down. Absolute game changer. We've had people get out of their fight or flight, get their lives back, get their brains back. Really, really powerful tool. Best advice for lupus causing kidney issues. So you've got to calm down that autoimmune reaction. We talk about this all the time, whether it's MS like my mom had that she reversed, like it's rheumatoid arthritis, whatever it is, you've got to fix whatever these, check for my other videos. You've got to find all these little lines that stick off of lupus and say, okay, fix the blood sugar, fix the adrenals, fix the vitamin D, fix the leaky gut, fix the infections, all these different things, and you've got to calm it down. So instead of coming with a bazooka to shoot that little squirrel, you can just get your little pellet gun and shoot the squirrel instead. And so instead of blowing up the whole backyard, you just get that one little squirrel, and that's what's happening with your lupus. So, anything else? Yeah. So some of these, I'm gonna have to pass on some of those conversations. We're being listened to and can only say so much. But yeah, as far as what we're seeing as far as detox goes. It's not really a detox that we're looking at. What we've seen with patients is it creates a major inflammatory condition. And so that inflammatory condition needs to be calmed down. So I would be looking at, as many anti-inflammatories, everything that we know that creates inflammation, do the opposite. So keep your blood sugar steady, work on your gut, do all those things. And that's going to be about the best that you can do. Okay, what do you suggest for low ferritin? So again, Mandy, you got to take iron. I mean, that's just, you have to start with iron, but you've got to work on healing up that leaky gut, calming down that inflammation in the digestive tract, all of those different things. Yeah, Paula, there you go. And all right, guys, I'm going to have to jump. I'll be looking at some of these other questions later, but I got to, wow, that's 45 minutes already. So love talking to you guys. So many questions, so much information that's needed out there. We could probably do an entire day of this. So keep looking. Thursdays, 8:30 Mountain Standard Time. I'll be getting on, ask questions. Just want you guys to be as healthy as feasibly possible. Let's get our bodies where they need to be, get that strength back, and just give you guys the tools to take on life and be the best you can be. I always want people to be able to give more, do more, and be more, and that's what you've got the potential inside of you. So make it a great day, stay strong, let us know if you got any specific questions. You can always DM us as well. Take care.